Hi, I'm Sebastian Kornefelt, and I'm a licensed chiropractor working out of my practice here in Stockholm, Sweden, out of Sveavägen. I've been working here in Stockholm for almost 8 years now, but I've also been traveling abroad with different sports teams and national teams, working specifically with sports injuries, everything from volleyball to soccer, football, ice hockey. It is also from here where I treat patients with LipusPlus daily, and it's a very new and effective treatment method and modality, and that I'm convenient in using, and it's, from my point of view, safe and very effective. So from my point of view, treating with a LipusPlus is an effective and a safe way due to the intermittent radiation from the lipus. It does not overheat any tendons or tissue that you're actually treating. And it also then prevents away from overtreating the area, and it's pain-free as well, which makes me able to choose the LipusPlus as a safe and effective and pain-free treatment modality from everything from acute to subacute and chronic diagnosis. From my point of view, what I consider is most unique with the LipusPlus technology is that it consists of 4 different techniques and modalities. So it actually is one of the only machines, or the actual only machine, that combines ultrasound technique along with 2 different light therapies, which is blue light therapy and infrared therapy, and magnet therapy. And due to its technical specialty, you could also choose the depth of how far you want to go into the tissue without overheating it, with 3 different types of megahertz and frequencies, which is also pretty rare and uncommon. This way it makes it more specific and easier to handle. And you also have a wider range of treatment issues and diagnosis that you can treat with it. So now we're going to demonstrate how you can applicate the LipusPlus into different types and kinds of diagnosis, and which type of depth and frequency you need to use for different types of diagnosis. To treat a patient with a stiff neck or inflammatory causes around tendons that can attach to the upper part of the thoracic back and the neck, we first applicate some ultrasound gel top of the patient around the revolving area, as to have a mediary from the device all the way up across the area where you're going to work. And this part is going to be the upper part of the trapezius, as to alleviate further stiffness and pain from the area of the patient. Turning it on, 0.5 megahertz. We start by the bottom part of the trapezius muscle, which inserts on the inside of the shoulder blade and between the upper part of the thoracic back. You work your way up with circular motions like so, all the way up across the shoulder blade, and then you round the angle of the shoulder blade where we actually twist the device horizontally. Work your way out, all the way out to the shoulder part, almost next to the clavicle and the acromion. Work your way back. We twist the device one more time vertically, and work all our way up towards the neck and towards the base of the skull where the suboccipital muscles attach. All the way out, down, twist it vertically, and circular motions all the way down past the shoulder blade, almost down to the mid part of the back. So here we demonstrate the pain areas of 3 different diagnoses from a shoulder patient. We have an supraspinatus tendonitis, and we have an infraspinatus tendonitis, as well as a subdeltoid bursitis. So as to treat this patient to alleviate from pain, the stiffness could also be a frozen shoulder. In order to treat the frozen shoulder especially, we need to target the joint capsule from many different angles of the entire shoulder, as well as the affected muscles around the actual shoulder. So at first, we applicate some ultrasound gel around the entire shoulder area, especially from the outside. So we're going to work our way around the entire deltoid part of the shoulder. Now, turn it on. We put it 0.5 megahertz, and we start straight out from the shoulder. So straight into the shoulder. And from here, we move up and down, all the way down to the mid part of the upper arm, since the deltoid inserts just on the mid part of the arm. So for a subdeltoid bursitis, we'll work straight into the insertion point of the deltoid. Circular motions like so. Now for the tendinitis, both subspinatus and the infraspinatus, we work more towards the front of the shoulder, since the subspinatus inserts on the front, just below the acromion. And work all our way back in a half moon motion like so. Every second time you come back to the front, you twist the device as to apply another vector. So the ultrasound will have a different target area, which will be a little bit more horizontally, as to cover all angles. This is also how you treat a frozen shoulder. All the way back to the spine, towards the spine, and to the front, all the way almost to the bicep tendon, and work your way down. Back and forth. Come back, turn the vector up, and all the way down. So, a patient with lower back pain that suffers from either sacroiliitis or myalgia, or even segmental dysfunction of joint dysfunction, most commonly have pain in these demonstrated areas, all the way up the chordatus lumborum, which is the lowest part of the rectus spinae, and also the insertion points of the medial glute, all the way from the hip, but all the way up to the iliac crest. So the definition of the lower back is actually from the first, or actually the lowest vertebra from the thoracic back, which is the 12th thoracic vertebra, all the way down to the S1, which is part of the sacrum. Now that also includes the part beneath the buttock, just below the glutes. So the entire hip area is actually connected to the lower back, but we're going to demonstrate how you treat the area of lower back pain, especially joint-wise and insertion points of muscles. First, we applicate some ultrasound gel on the prescribed area. And you applicate it all over where you're going to use the machine and the device. Now we've got thick layers here. We've got about 2 decimeters of muscle that run all the way from the top down to the center of the spine. So we turn the device on and we put it on 0.5 megahertz. From here, start from the middle, turn the vector horizontally, and you work your way out towards the iliac crest. All the way out to the utmost part of the glute, and back. All the way out, and back. Now you can see the spine is centralized here, so we need to work on both sides of the spine. Depending on which side is more effective muscularly, you can work more on that side. But the recommendation is to work both sides equally. So all the way out, across, and then to change the vector and get more different angles, you turn it vertically running all the way up along the spine to the 12th thoracic vertebra. Change sides, go up and down. And make sure that you pass the sacroiliac joint, which is just located between the L5, which is the lowest part of the lumbar vertebra, and both sides of the iliac crests, and work your way down a little bit towards the sacrum. Here we're demonstrating a patient with a hip pain. You could either suffer from sacroiliitis, could either be irritation myalgia due to herniations or radiculopathies, but also due to tendonitis, piriformis syndrome. It could also be a trochanteritis, which is an inflammation of the bursa, just below the trochanter, the greater trochanter. Now, first we applicate some ultrasound gel and applicate it all over the area where you're supposed to work, which should be the entirety of the hip. Now, make sure that you use the ultrasound gel richly, so that you'd rather apply even more just to make sure that the area is all mediated for the device. Also, during the treatment process, make sure that you're not running over a dry area, so reapplicate some ultrasound gel as needed. Turn the device on, 0.5 megahertz. You put the device vertically from the outer medial part of the sacrum and work yourself all the way down towards the outside of the hip and the greater trochanter, where we would do twisting clockwise and counterclockwise motions all the way back and forth, as well as circular motions, and switch between those as to cover all angles that you need. Work your way back, move a bit higher, all the way down towards the outside of the trochanter and back. And we have the iliac crest just up here, so work all your way just below the iliac crest and back. So here we demonstrate a patient with a patella tendonitis, and this is the part of the patella. Just below it you have the patella tendon that inserts on the tuberositas tibia, which is just below here. Now you want to work on the exact area of the inflammation. So I recommend that you actually palpate through the lower part of the patella and the kneecap as to see where the patient suffers from most pain, where it's most sore or most tender. These different markers show the areas where it could be most affected. It could be all of them, it could be one of them, depends. So from here, we applicate some ultrasound gel just below the kneecap. Applicate all over the area. Turn the device on, 0.5. Put the device straight under the knee and work your way like a square down to the tuberositas of the tibia, all the way up to the outside of the kneecap, across the kneecap, and down. Square motions. Make sure that you actually turn the device vertically in order to get the posterior angle as well. So then you just work your way across the patella from the inside and the outside. Now, the patella is pretty superficial, so you want to make sure that you go through the patella, so twist it almost towards the outside, as well as towards the inside from the outside and up top. So square motions, down and up, turn, inside to outside, outside to inside, all the way from the bottom part of the kneecap down to the tuberositas tibia. And that is an area of estimately 1 decimeter that you need to work down and up. So here we're demonstrating a patient with a plantar fasciitis. The plantar fascia attaches just above an upper part of the calcaneus, all the way down, and it actually spreads like so, like my fingers, all the way out to the arch and the ball of the foot. So where the plantar fasciitis is going to be most painful is often in the area just a little bit towards the medial part of the body of the calcaneus, just here. So you want to work your part all the way from that point and up, and that point and down towards these 3 points, as to cover all of the different aspects and parts of the plantar fascia. First, we apply some ultrasound gel around the area. Make sure, especially with dry feet, that you have enough ultrasound gel as to not run over dry parts. So lavishly with the ultrasound gel rather than dry. From here, you turn it on, you put on the 0.5 megahertz. We put the machine and the device vertically from the calcaneus and down. Work it around the calcaneus. Turn it vertically and all the way down the plantar fascia until you come down to the ball of the foot, where you twist it one more time. Twist back. Move up and along all the way to the lower part of the calcaneus, where we turn it vertically once more, horizontally, sorry. Out and to the inside. You could also work a little bit higher up. So you just want to target the tendon, which is right here. So down towards the sides, twist the device vertically, move it down, twist one more time horizontally when you come to the ball of the foot, twist it vertically and up and back. As demonstrated, we have a patient with peroneus tendonitis. Could also be a sprained ankle with the utmost talofibular ligament on the outside that attaches from the lateral malleoli all the way down to the talus bone, which you can see on the 3 utmost upper part, which I've marked out here. Those 3 points represent the different parts of the ATF ligament. This lower part here is the insertion point of the posterior peroneus muscle, all the way behind the malleoli down to the insertion point of the talus. So you apply some ultrasound gel. Make sure that it's lavishly put so as to cover every dry area. You'd rather have a lot more here than you'd suspect, as to have a good mediary. From here, put the device on, put it on an 0.5 megahertz, and you apply the device straight below the malleoli with a horizontal angle. Then you work all your way below and back towards the mid part of the malleoli and towards the front and up. So actually what you do here is that you round the malleoli as to cover the peroneus muscles on the outside of the ankle joint on the outside. We twist the vector part of the machine and device vertically down and go up and down like so, all the way down to the outside and the utmost lateral part of the foot. Back up, twist it horizontally, and work back and forth.